Hello, my name is Bernadette Sherry, and my colleagues and I are presenting the following modules, which started as a workshop at New Jersey City University through the Health Science Student Organization, and is now collaborating with Rutgers University and NJ Sophie as host agencies for further implementation of peer-to-peer learning. It is the first amongst its kind to prepare for the NCHEC Certified Health Education Specialist exam, or the CHES exam. It is encouraged for students from any educational institution to utilize this method of teaching and learning under student-run supportive environments. It has been proven that peer-to-peer education is a more effective way to learn as opposed to a top-down version of learning. This CHES workshop has been designed with the understanding that this method is one of the more effective and conducive methods to learning outside of the classroom. With the rapidly growing field of health education, although voluntary, more professionals are opting to sit in to take the CHES exam. This is why it is imperative for us to try many different ways of acquiring the knowledge and the information and utilizing this information that has been taught through our undergraduate studies. Our team is here to introduce the peer-to-peer workshop we created in order for all of us in our last year of higher education to transition into becoming certified health education specialists. We will be accomplishing this transition by taking the CHES exam. The exam is made to be a tool that has been put in place to measure the amount of knowledge that has been acquired as a graduate in the health education field, and how that knowledge has been applied and interpreted according to the 7 areas of responsibilities, competencies, and their subcompetencies. The certified health education specialists are tiered into 3 levels. There is the entry level, Advanced 1 and Advanced 2 levels within the health education practice. Please note most of the material that is presented within this workshop covers the entry-level material that has been confirmed within the criteria from the Health Education Job Analysis 2010 study for this current version of the CHES exam. The criteria of HEJA 2010 includes an updated version of the standard set of guidelines among all health education specialists, regardless of the setting the certified health specialist is in. In order to describe what these responsibilities and their counterparts are, I have to go through a quick overview of the history of CHES and how it has developed to what it is today. So in other words, I will be summarizing just about 70 years of history in about 5 minutes. I will review the history and background of CHES in a chronological form of explanation. As I do so, please refer back to the organizations on these slides who have made large contributions to the industry we have today, and in some cases continue to do so. The original health educator was known as a school health educator or a school teacher from the late 19th century to about the 1940s, at which this point professionals felt the necessity to create quality assurance amongst health educators across the board by setting the need for creating a baseline in context to professional standards. Many professional organizations began introducing guidelines and promoted accreditation programs to assist in the development of the health education profession. By the 1978 to be specific, the National Task Force of the Preparation and Practice of Health Educators was established in order to carry out research collected through the Role Delineation Project of the 1970s. In summary, these organizations collaborated to fulfill accreditation by creating a curriculum that supports the professional job description that has come to practice today. The Role Delineation Project was a result of various professionals from all sorts of health and education settings getting together And at the first Bethesda conference, they discussed and questioned what exactly is the role of a professional health educator and what does that job entail. Plenty of discussions followed, high amounts of research was conducted, and finally, by 1981, a health educator was defined by a set of roles, skills, functions, and expected level of knowledge. These guidelines became the common level of practice for all educators as their generic role, or at least the starting point of what a health educator should be able to carry out and exhibit. By 1985, after many more conferences, workshops, and meetings with all sorts of professionals affiliated with health, education, and profession, a curriculum framework was created to provide the proper education background to align with the professional set of skills that has been set forth by these organizations. The curriculum document was called a Framework for the Development of Competency-Based Curricula for Entry-Level Health Education. In 1986, the second Bethesda conference, there was a consensus that a certification process must be put in place to ensure that the individuals who deliver health education services must possess at least a minimum level of competency. This is where it was decided to create the National Commission for Health Education and Credentialing, better known as NCHEC, which was put into practice by 1988. Through NCHEC, the first examination for CHES was conducted in 1990. This huge step in certification should be easily attributed to the competencies presented and originated from the role delineation project. Once the entry level was established in the 90s, the organizations that created this first process started thinking about the graduate level of competencies and subcompetencies and responsibilities. In this manner, they then created Advanced Level 1 and Advanced Level 2, Certified Health Education Specialists. When they created the graduate level competencies, they decided to revert back to the entry level just to reassess what it was that an entry level person does, what the advanced level person does, and what the advanced level 2 person does. So they can kind of like flow within the process of expertise and flow within the process of learning and experience. So in 1998, NCHEC initiated the National Competency Update Project, known as the CUP Project, along with AHI, SOFI, and 9 other health education-related organizations. The project, which lasted about 6 years, released their findings in 2004, and by 2005, the results led to the 7 updated area of responsibilities, the 35 competencies, and 163 subcompetencies, along with the 3 levels within the health education practice. The entry level consists of having experience of less than 5 years with a bachelor's or master's degree. The advanced 1 level consists of 5 years of experience with over 5 years of experience with a bachelor's or master's. So entry is less than 5, advanced 1 is over 5, still bachelor's and master's. And the advanced level 2 is over 5 years with a doctorate. So those are how it's tiered within the realm of the health education practice. Because there were 3 distinct levels of practice, a cup model was introduced to display the hierarchical visual. Along with this new cup model, AHI, SOFI, and NCHEC made recommendations to revise and update the framework, study guides, and exams, which were approved and endorsed by all of the member organizations of the Coalition of National Health Education Specialists and put into practice in 2006. The CUP study produced a great foundation, but as health educators, we must always stay current with trends and data. The National Commission of Credentialing, and CCA, requires a professional role delineation, or a job analysis, to be conducted periodically and validated every 5 years. NCHEC consulted with NCCA and the Professional Examination Service to advise them on the job analysis process. Well, the Professional Examination Service created a research design for the needed analysis based on industry norms, and produced an 18-month research project which was named HEJA 2010, which stands for the Health Educator Job Analysis of 2010. Although I was only going to cover the history, I would like to take the moment to show how, as health educators, we must stay current and our recent update, which is HESPA 2015, stands for Health Education Specialist Practice Analysis Project. That's a mouthful. Now, the purpose was to fulfill the entry-level educator and determine if there were any major changes since 2010. The reason I mentioned it is because I just want everyone to take note that you must look for the updates and the study guides when you are encountering 2016. We will always stay updated, we will always stay current, and there will always be a reanalysis, reassessment, which is what we do as health educators. So now, with the history and the importance of our industry aside, we will now present what the responsibilities are. And that concludes our introduction.